Once you have the options created and you've narrowed the list to the appropriate number for what you're trying to do, and you're at the point where you want to select and begin to move to a decision process, polling is an effective way to move forward after you've done the prioritization. You can do it in a couple of different ways. It's often done by asking people to affirm that they understand and can support the option or options, and they'll do whatever it takes to implement it. And this option, it's really important to note, by doing this affirmative polling, it doesn't have to be each team member's first choice. What you're asking them to vote is that they understand and can support that option as the group's choice. So there's also a way to do that kind of in the reverse. You can do a negative poll to reach a similar conclusion. And so you're really asking it in the opposite way by saying, is there anyone who cannot support this option, even if it's not your first choice? In this way, you're able to take the pulse of the group and understand how close you are to reaching a group decision. So we've mentioned a couple of times already how important documenting and recording your work is. Throughout the process and throughout the meetings, you want to be recording and documenting the options and how the group has progressed. This will help people catch up who've had to miss meetings. This will help your colleagues in the future. This can help you be a learning organization and be smarter each time you're addressing quality improvement projects. Tracking and recording the discussion can either occur if you have the electronic capability to do it right there in the room with you on a computer screen as you go along, or it can be as simple as in a flip chart page where you're highlighting the key options and decisions and noting the votes that were taken. But either way, it must be kind of a public record of the meeting. By public, it doesn't necessarily mean to the greater community, although in some cases that might be appropriate. But by public, it means to the rest of your organization or to your partners. You want quality improvement work to be as transparent as possible. It really helps to reduce understanding and gain support for what you're trying to accomplish. So now I'm going to move to decision-making approaches. There is no one right way to make a decision, and we want to really emphasize that. The important thing is to convey what the decision approach will be and to do that as soon as you know what that process is. I suspect we've all had the experience, and I know there's nothing worse than going into a meeting and going into a group process thinking you have a particular role or a voice or a vote, and then to find out later that that's not what the decision basis was in that meeting. It can be disenfranchising, to say the least. So it's essential to be clear about the decision basis, what that will be for this particular decision or process, who has that authority, and what approaches are, what the approaches will be for this team. So on this slide, we've listed for you the 5 most common decision approaches. One is by lack of response or a non-decision. We've probably all seen this occur, whether it was intentional or not. But the other 4 are really intentional approaches around decision making. Decision by authority is the example where one person has the authority and really the responsibility to make the decision. They may be seeking input from the team and doing that throughout the course of the meeting, but they are the ones that ultimately in the end are making the decision, and they have the authority and the responsibility to do that. That's really appropriate in certain instances, that it's a single person who's doing information gathering and then he or she is making the decision. Sometimes there's decision by minority. It might not be just one person, but a small group of people. It might be a particular combination of the leaders or managers of an organization. And again, they might be seeking input, but then they'll take that under advisement, and they, as a small group, maybe 2 or 3 people, ultimately will be making the decision. Decision by majority is often how voting occurs, when you say the majority of the voting members of the team are the ones that will, that the results of that vote will be what will affirm the choice for the decision. And then there's decision by consensus. We want to spend just a minute talking about consensus because I think it's often seen as the gold standard around decision making. But we want to emphasize again that it can be and sometimes is appropriate, and quite often is in a quality improvement project mode, but it's not always the right decision approach for every situation. So group consensus is finding the alternative that's acceptable to all and reaching a decision based on what everyone can accept. No one opposes the decision. Again, you might test through polling, or you might hear comments that said, I can support the decision even though it's not my first choice. It's important to note here that silence does not always equal consent or assent. And so if you're using a consent approach where you want every team member to say, yes, I support this, even if it's not my first choice, you need to ask each team member for their yes or no vote. But there are situations, as I mentioned, where consensus may not be appropriate. Perhaps the team lacks the technical expertise or skill to make the decision. They can help inform, but they're really not the right group to be making the final decision. Or perhaps it's a crisis situation that requires immediate action and you don't have time to take something to a team. Consensus is often something that does take quite a bit of time to achieve, and some decisions may need to be made in a more timely manner than consensus allows. Or perhaps the decision is outside of the scope of the team's authority. They have relevance to the work and it's important to them, but the decision is really not within their authority. Again, the most important thing is to be clear about what the decision basis is, how it will be implemented, and to do that early on in the process. The fourth of the process areas is the action steps and accountability. This occurs after the meeting is done and you prepare for the next steps. So regardless of whether agreement or a decision is reached, it's really important to identify clearly what the next steps are and to be sure that responsibility is assigned for each of those steps. For the group to know how it is holding itself accountable for the implementation of whatever the actions are. So I want to cover just quickly some common things that occur as you might be facilitating or participating in quality improvement team meetings. So we just quickly laid out the basics of building a team and effective team management and facilitation, and it all sounds fairly straightforward and easy to do, and it's really not. It requires a lot of careful attention, and challenges often arise. So we want to spend a little bit of time talking about the common challenges that occur and present you with some strategies for overcoming these challenges. Facilitation is, of course, a critical resource in fostering group effectiveness and success, and we've already talked about the role and responsibilities that a facilitator has. But a facilitation is also important in dealing with the challenges that arise throughout the course of a team project or a meeting. First is around conflict resolution. There are some common approaches that are often used to manage conflict. Sometimes they work, but typically do not always result in the best outcome. If you think about ways to manage conflict, you can also think about their implications. And here are just a few of them. Compromise is a common way to resolve conflict, but in that instance, both parties settle for something less. Again, that could be the right approach, or it could have other implications. There's also commonly conflict avoidance. Issues are simply ignored or sidestepped. Unfortunately, they often pop up later and sometimes unexpectedly if they're not resolved at the time. Accommodation is another conflict management strategy. It arises when the focus ends up being on the relationship and preserving the relationship, which often sacrifices whatever the decision or action is in order to preserve that relationship. And lastly, dominance is a strategy for overcoming. Someone simply charging through with their agenda and their decision. Conflicts are managed through directives for change in this example. Simply said, if someone announces this is how it will occur or how it will happen. We want to instead give you a script for conflict resolution that's borrowed from team steps. It's just describe, express, suggest, and consequences. So if you are the person that has concerns, this gives you a way to structure that in a really productive way. Or if you're the facilitator, this gives you a mechanism to call out the conflict in productive ways that can lead to resolution. So the first step in this four-step process is really describing the specific situations. Sometimes it's really enormously helpful to simply name the conflict that is in front of the group. Secondly, to express the concerns about what the proposed action or solution is, trying to express them as neutrally as possible, focusing on the facts and the implications and the concerns that you might have. S is for suggesting other alternatives. What are some variations or some different approaches that might make the group help to meet its purpose? This isn't about throwing the original idea over the fence and saying it won't work, but instead saying, this won't work from my perspective, here's why, and here's how we might do something alternatively. And lastly, consequences, to be stated in terms of the impact that they'll have on the team goals, keeping that purpose as the true north. And again, checking yourselves against that purpose in trying to resolve conflict. I can't say enough about the positive contributions that collaborative culture and environment makes to achieve a mutually satisfying solution that really can result in the best outcome. We're all looking for those win-win situations. So including a commitment to collaboration as part of the mission and the common purpose can be really important to setting those ground rules about how a team will work together. Collaboration allows meeting the goals without compromising the relationships. We're going to switch gears now and share with you a little bit about some typical quality improvement meetings and how agendas might be set for those meetings, to give you some concrete and tangible examples and tools to leave with as you think about these effective facilitation and meeting management strategies. So I'm going to turn to my colleague Janelle and have her walk through a few examples of this.
Okay, thank you, Jennifer. So one of the most helpful ways to have an effective meeting is to make sure that you have a clear agenda. And we frequently receive requests to give sample agendas, but there's really not one size fits all for agendas because the purpose of the meetings are different. But there are key components that will help structure the meeting and guide the group process. So if provided in advance, the agenda can help people prepare for the meeting. And if there's any pre-work to do, it will allow them time to do the pre-work and then fully participate in the discussion. So sending an agenda ahead of time helps the participant to be more fully assured that the time will be well spent. And a good agenda demonstrates that there's going to be value in the meeting. A poor agenda might say, it could be a waste of your time. Whereas a good agenda is detailed and specific for each meeting so people know what they're trying to accomplish at the meeting. Again, a bad agenda signals it's generic and the same each time, kind of repetitive, just same old, and not worth the time. So we're going to provide 3 sample agendas today for you to consider. The first is going to be for a quality improvement planning and prioritization meeting. The second will be for a topic-specific performance improvement kickoff meeting, so the first meeting when we start a project. And then the third one will be just for ongoing quality improvement meetings. So this first one here is for the QI planning and prioritization sample agenda. And your team might be meeting to consider what opportunities for improvement do we want to work on. And so they need to decide that and prioritize what would be important to work on. So in this example, you will note on the agenda that there is a prerequisite. So before bringing the group together, there's going to be homework. And the whole idea for that is that people will have some background and something to share with the group. So for an example, when you're looking to decide what kind of projects do we want to work on, the director of an organization might bring quality indicators that have fallen below what the standard or threshold would be. An administrator or HR person might bring the latest staff or participant satisfaction surveys. Or other departments may have other audits that they keep track of and they're falling below what they really want to be. So they would review that data before they come to the meeting. The key is that not every piece of data is brought to the meeting, but just key components. So the idea would be that the items we brought to the meeting for group discussion. So that would be the whole point of doing the homework, bringing the key points, and then discussing it with the group, not just providing the information to the group. So if the group is ready to review potential opportunities for improvement and make decisions about what to focus on, the agenda on this slide might be helpful for that type of meeting. can see the first three items. They could be standard for most meetings. And if enough information is provided on the agenda, it should really take very little time. You want to make sure that everyone knows who's at the meeting. Many times you go around and do introductions, your name, your role, what you do. And you want to make sure that everybody knows what the goal is for the meeting. Like Jennifer said, we've probably all been to meetings where you come in and it's like, why are we here? So you state it right up front. This is what we want to do for the meeting. And then, everybody's on the same page. And then also discuss meeting roles. Maybe it's changing who's taking the minutes, who's taking, who's going to be the timekeeper, that type of thing. But so you know what's going on with that. And then it's also good to provide a brief introductory or background comments just to get everybody on the same page as much as possible. So that's at the very beginning of the meeting. Really doesn't take very long. And based on the data that happened during the homework, you will start to brainstorm the opportunities for improvement. And you look at what are the things that are rising to the top? What are the things that we're interested in? And then once you've identified the topics, decided on a process, you need to use how to clarify, narrow, and make decisions. So you think about what are the criteria that you're going to use to guide your decision-making process. And one tool that is real helpful in this is a prioritization tool. And what that includes is a systematic process that lists different criteria and then essentially kind of check mark or vote, and it helps you to identify what would be most important to work on. The agenda should always include items at the bottom, which are to be clear about what the next steps are. So what needs to happen based on the decisions we made today? Who's going to do what and by when? What are the action steps now that a quality improvement project has been selected? And of course, you want to document so everybody knows what we've decided. Okay, the second sample agenda is for a quality improvement project kickoff meeting. So this will be the first meeting once you've decided what you're going to do. So if you look at the agenda, examples again, the first two bullet points are pretty standard. Well, actually, the first three are pretty standard, which is meant to get everybody on the same page. So you introduce each other, you talk about the roles, and then you talk about what you're going to do. So if you look at this example, goal is to discuss and commit to a charter, which is pretty specific. So people know exactly what they're coming together for. And then it's also to clarify anything that's needed. Next, in the example, the group would identify the process they want to use to better understand the problems or opportunities in order to plan and make changes that truly address their process. So for example, depending on what the problem, the group might want to do root cause analysis, they may want to do some process mapping or doing a failure mode effect analysis. So depending on the meeting, you might even be able to do some of that at that first kickoff meeting, depending on the topic. If it's not terribly complex, you can start in on some of the process mapping. And then based on findings, the group can discuss and commit to the process that will be used to identify what changes to make, what things they want to plan for, what they're going to implement, what they're going to monitor. And for example, you might use the Plan, Do, Study, Act, which is a real common quality improvement method. And when you use cycles to pilot test areas of change. The last two agenda items are pretty standard, but you want to make sure that you do those to develop a communication plan. So what is it? How are you going to get the information out to the team and to the other people that need to know about the project? And then again, document the next steps. Who's supposed to do what? When should they be done by? And the last example we want to show you today is for an ongoing quality improvement meeting. It has some of the standard agenda items, both at the beginning and at the end. And the focus for this meeting will really be to talk about what changes have been put in place based on the priority of the project that the group wants to work on, and to make some decisions on how to go about it. So again, you see the first couple things on the agenda are the same. We introduce everybody, you know what we're trying to accomplish today. So the idea of these meetings are to review the PDSA cycle. So these are the tests that you've implemented in your project. So you're going to ask, what changes do we need to make based on our analysis about keeping the changes? are the changes we made linked to the root cause analysis? So are they something that will really impact the problem or the cause of the things we want to change? You want to make sure that it's going to lead to system change, not just weaker interventions like more education or reminding people or discipline staff, but that it really should be at the system level. You want to make your plans clear as you implement your changes. Then as you test these changes, you want to study the results. How did it work? What things were good? What things would we change? So basically, you make one of three decisions. You either adopt the change because it works so well, or you adapt it. That's what you do most, where you change it a little bit, tweak it, or if it totally flops, you just abandon it. So the group will make that decision. So hopefully, these three agendas provided a few tips for you as you have your quality improvement meetings. And Jennifer, we'll turn it back over to you to close out.
Great, thank you. Thanks, Janelle. Did I go one too far? Okay. Well, we do have a slide in here that includes a few resources for you. It just brings us to the final section of today. We, of course, started out with the Institute for Healthcare Improvement. This is really the organization that, for many in healthcare, provides the best of the tools and resources that reflect evidence and best practice in quality improvement. We've also linked for you a set of tools that are specific to nursing homes, to long-term care, but really are built generically on a lot of really terrific quality tools that have been adapted for long-term and post-acute care, and you can find them on the website links there. We also recommended a book for you, Getting to Yes, How to Negotiate Agreement Without Giving In. This book's been around for a long time. Some of you may already be familiar with it. It's a small book that's available in paperback. But since conflict is such a common problem and barrier, and it's so difficult for so many people to address, we included it because it really gives some practical, helpful strategies to think about your position in negotiation and conflict and how to get to yes, really looking for those win-win outcomes. The last thing we have on the linked here as a resource is a link to the Holden Leadership Center at the University of Oregon. And the particular tool that we would draw your attention to there is a meeting evaluation checklist. This is a really useful tool that categorizes how things like planning for the meeting, how well organized the meeting was, the level of participation, the value of the meeting, and the attitude. It provides specific questions that we encourage you to use on a regular basis as part of quality improvement team meetings, and on an occasional basis for the work of a team as you go forward. Again, very useful and practical suggestions. So we'll leave you with two thoughts, and then I think we have just a few minutes to open it up for questions. A facilitator is the custodian of the consensus process, the servant leader whose purpose is to help the group make the best decisions possible. I think that really sums up a lot of what we were talking about today. And then really a favorite quote of ours at Stratis Health, which really reflects the spirit of continuous improvement, comes from Maya Angelou. I did then what I knew then. When I knew better, I did better. So with that, I'll turn it back to Carrie, and if we have a few minutes, we can open it up for questions and see if any of the participants today have anything they want to ask us.
Absolutely. Thank you to you both. Lots of great information and tips and resources for everybody, so thank you very much. And so, yes, we'll take some time for questions. So those of you who have questions, I think we'll take them by email. You'll see the link on the slide in front of you. So if you'd like to email, and then we can share the questions.
We don't have any questions in right now, so we'll just perfect timing. This is Miriam. Just to remind you of our next HCBS PIP webinar on April 21st with Lori from the Institute for Community Integration, and we're going to be having a quality improvement focus area for that webinar that was highly requested from the PIP folks, looking at staff retention. And so that'll be a month from now at the same time, 10:30 to 11:30. So I hope that that you'll put it on your calendar and join us again. And we don't have any questions yet, but there is just a little bit of a delay, of course, from when we say things to when you hear what we're saying. So I'd encourage you to send in questions, and if we don't get them to them today, I'm sure we'll be able to forward them on to Janelle or Jennifer. And if we can't answer them, and that they can send you an email.
So maybe while we're waiting, if there's questions coming in by email, Miriam and Carrie suggested a question that I'll circle back to when we were talking about the polling of a group to help prioritize and reach a decision. One of you asked us, how do you handle no in a negative poll? What if there is someone who just really can't support the decision that the rest of the group seems to be gravitating toward? And so if I can circle back to that, we have two strategies for dealing with that when it turns out that even if you've moved through the process, there's still not agreement. One would be to move the process back upstream a step so that you're back at the multi-voting and rethink how you have cast the options and see if there are some variations in how you have described that by asking the person or persons who aren't able to say, yes, I can live with this, if there are some changes, some tweaks that they can make to make that option workable. Moving it back up a step and then recalling for the vote often can lead to, it's often just one small piece of it or one thing that's just not working for that person or for those people. And so if you can move it back upstream and then bring it back to the vote, often that generates enough satisfaction in the solution and the recasting of that you can get to that consensus.
Well, we are getting towards the end of our time, but if you didn't get a type fast enough to send in your email, please still finish up that email and send it through, and we'll get a response back to you. And thank you again for Jennifer and Janelle for being here today, and for all of you to listen in and email us at dhs.hcbspip@state.mn.us if you need any of the materials, if you didn't get those today, or would like to be notified about future webinars. Thank you again, and